It doesn't hurt. Until it's too late. That's the terrifying truth about clogged arteries. Most people feel fine. They walk, talk, eat, even laugh with family. Then one night, they don't wake up. Or they suddenly can't move one side of their body. No chest pain, no warning. Just a heart attack. Or a stroke. Here's what the science says. More than 70% of artery blockages show no symptoms until a life-threatening event occurs. And this isn't rare. According to the CDC, over 18 million adults in the U.S. are living with coronary artery disease, most of them without even knowing it. If this is your first time on the channel, I invite you to subscribe so we can walk this path to better heart and brain health together. Now let me tell you something that most people never hear from their doctors. Your arteries can heal. Yes, even after 60. Even if you've already been told you have high cholesterol, or poor circulation, or early signs of heart disease. The key is to stop feeding the problem and start nourishing the repair. And what if I told you that some of the most powerful artery-repairing foods aren't expensive supplements or new drugs, but small, colorful fruits you might already have in your fridge? I'm talking about berries. These are not just tasty little fruits. They are biochemical warriors, packed with anti-inflammatory compounds, fiber, polyphenols, and natural acids that can help break down plaque, calm swollen blood vessels, and restore healthy blood flow. Over the next few minutes, I'm going to show you exactly how each berry, strawberries, blueberries, raspberries, and blackberries, works inside your arteries. Not in theory, but in the real world, in the aging human body. Because this is not about trendy superfoods. It's about survival. It's about circulation. It's about keeping the blood flowing to your brain, your heart, your legs, so you can stay strong, stay sharp, and stay independent. Let's begin with the one berry that's so common, yet so underestimated, the strawberry. When most people think of strawberries, they think of sweetness. Summer mornings. Desserts with whipped cream. But to the arteries of an aging adult, strawberries are something else entirely. They're medicine. Here's what happens inside your blood vessels every time you eat them. Strawberries are packed with anthocyanins, natural pigments that give them their rich red color. But anthocyanins don't just look beautiful. They act directly on the endothelium, the thin layer lining your blood vessels where most of the damage from aging and poor diet begins. In older adults, this endothelium becomes stiffer, more inflamed, and less responsive to signals that tell it to relax. That's why circulation slows, why your feet may feel cold, why your blood pressure rises, and why tiny clots begin to form in places you can't feel until they stop the blood entirely. A study published in the American Journal of Clinical Nutrition in 2014 showed that just 8 weeks of daily strawberry intake led to a significant reduction in arterial stiffness and LDL cholesterol among older adults with metabolic syndrome. But how? The polyphenols in strawberries help restore nitric oxide signaling in the endothelium. That means your blood vessels can relax when they need to. They can widen, soften, and allow more oxygen-rich blood to flow where your body needs it most. Your brain, your heart, your legs. At the same time, strawberries reduce oxidative stress, one of the key drivers of plaque buildup. By neutralizing free radicals in your bloodstream, they prevent further injury to the artery walls. And then there's the fiber. Strawberries contain both soluble and insoluble fiber. Soluble fiber binds to cholesterol in your digestive tract and helps remove it from your body. This means less cholesterol available to form dangerous plaques. One woman in her 70s, with a history of borderline cholesterol and mild hypertension, added strawberries to her breakfast every morning. 8 weeks later, her doctor noticed a drop in both LDL and systolic pressure. No medication changes, just berries and consistency. Now, what's the best way to use them? Fresh is ideal. But frozen is just as powerful, sometimes even more so, because they're picked and sealed at peak ripeness. Aim for half a cup to 1 cup per day. Mix them into your oatmeal, blend them into a smoothie, or simply eat them whole after a meal. Let their natural sweetness satisfy your cravings, instead of reaching for processed snacks. If you're diabetic or watching your sugar intake, strawberries are one of the safest fruits to enjoy. Low on the glycemic index, high in antioxidants, and incredibly nutrient-dense for their calorie count. You don't need a fancy supplement or an expensive powder. You just need the courage to make space in your day for the things that truly nourish your blood. Because every time you choose strawberries over a sugary dessert or salty snack, your arteries feel the difference. And they remember. Among all berries, this one carries a special reputation. Not just for its taste, but for its quiet strength. Blueberries are often called the brain berry, and that name is well earned. But what most people don't know is that the very same compounds that protect memory also restore blood flow, especially in aging arteries. Let's start with inflammation. At the heart of every clogged artery is one common trigger: chronic low-grade inflammation. It begins silently, triggered by sugar, saturated fats, stress, and time. The lining of your blood vessels becomes irritated, stiff, and sticky. And over time, fat and calcium begin to latch on. That's where blueberries come in. They're loaded with anthocyanins, powerful plant pigments that directly reduce markers of inflammation inside the vascular system. But they do more than reduce damage. They help reverse it. A clinical study published in the Journals of Gerontology in 2019 found that older adults who consumed a daily blueberry supplement for 12 weeks had improved endothelial function and reduced arterial stiffness, two key drivers of hypertension and vascular aging. Endothelial function is the ability of your blood vessels to expand and contract properly. When this function breaks down, your arteries become rigid. Blood flow slows. Pressure builds. And your organs, especially the brain and heart, suffer. By restoring this flexibility, blueberries allow oxygen-rich blood to reach deeper and farther. This is especially critical for older adults, where circulation to the extremities and the brain tends to decline with age. But blueberries go even further. They also reduce oxidative stress, a major factor behind the oxidation of LDL cholesterol. When LDL becomes oxidized, it is far more likely to stick to artery walls and form dangerous plaques. Blueberries neutralize those unstable molecules before they cause harm. A 2015 study published in Applied Physiology, Nutrition, and Metabolism demonstrated that daily blueberry intake improved blood pressure and vascular reactivity in postmenopausal women, a group especially vulnerable to arterial damage. So why do these effects matter? Because poor blood flow is not just about the heart. It affects how you think, how you move, how you sleep. It influences your mood, your memory, and your energy. The more freely your blood flows, the more alive your body feels. Now here's the part that surprises most people. You don't need a massive amount to see a benefit. A handful a day. That's all. Fresh or frozen. Mixed into yogurt. Tossed into oatmeal. Or eaten just as they are. Blueberries don't shout for attention. They work in silence, repairing the walls, easing the pressure, and bringing back the rhythm your body once knew. And the best part? They do it naturally. Without side effects. Without warnings. Without waiting for things to go wrong. The earlier you bring them into your routine, the longer your arteries will remember what it feels like to be young again. They're light. They're tart. They barely weigh anything in your hand. But raspberries carry an incredible power when it comes to blood vessel health, especially for older adults living with high cholesterol or insulin resistance. What makes raspberries so effective is their unique combination of ellagic acid, polyphenols, and soluble fiber, three forces that work together to protect and cleanse your arteries from the inside out. Let's begin with fat metabolism. When we talk about plaque inside the arteries, we're mostly talking about oxidized LDL, the so-called bad cholesterol. Raspberries contain compounds that directly reduce LDL levels in the bloodstream, while also preventing that LDL from becoming oxidized. which is the form that truly sticks and hardens inside arterial walls. In a randomized clinical trial published in the Journal of Nutritional Biochemistry in 2021, researchers found that consuming freeze-dried raspberries for 8 weeks significantly reduced total cholesterol and improved insulin sensitivity in overweight adults with metabolic risk factors. This is critical for older adults, because when blood sugar fluctuates wildly, it inflames the lining of your arteries. It makes the blood stickier. It triggers the liver to produce more fat. And over time, it lays down the perfect environment for plaque to form. Raspberries act like a small but effective cleanup crew. Their polyphenols reduce inflammation. Their fiber slows sugar absorption. And their natural acids help reduce triglyceride production, the fats most often elevated in people with poor circulation or fatty liver. One man in his mid-60s had borderline triglycerides and struggled with post-meal fatigue. After adding raspberries to his afternoon snack, his energy returned, and his blood test improved noticeably within 2 months. But raspberries don't just help with fat and sugar. They also stimulate nitric oxide production, which helps your blood vessels dilate. The wider the vessels, the more blood can flow through with ease, and the lower your blood pressure. Another 2016 study from the British Journal of Nutrition confirmed that daily raspberry intake improved vascular reactivity and reduced arterial stiffness in a group of healthy older men. Even without other dietary changes, the effects were measurable. So how do you use them? Fresh raspberries are wonderful, but they're delicate. Frozen raspberries, on the other hand, are convenient, affordable, and just as potent. You can add them to smoothies, stir them into overnight oats, or eat them by the spoonful with a little plain yogurt. Their acidity pairs well with walnuts, flax seeds, or even a few shavings of dark chocolate, all of which support cardiovascular health. The key is frequency, not perfection. You don't need to eat raspberries every day to feel the benefits. But weaving them into your weekly rhythm 3 or 4 times, even in small amounts, is enough to gradually shift the balance in your arteries. Away from buildup, toward repair. Because the truth is, most artery damage doesn't happen in one night, and healing won't happen in one bite. But consistency creates change. And raspberries are one of the most powerful tools nature offers for that change. Sweet, simple, and often overlooked. Among the many berries we celebrate, this one is often forgotten. It hides in the corner of the fruit bowl, darker, richer, less glamorous than its cousins. But when it comes to vascular health, blackberries deserve the spotlight. These small, deeply pigmented fruits are one of the most concentrated natural sources of anthocyanins, the very compounds that repair and strengthen the walls of your blood vessels. The difference is, while other berries tend to focus on arteries, blackberries seem to carry a special affinity for veins and microcirculation. And in older adults, that distinction matters. With age, the tone of your veins weakens. They stretch. They lose their ability to push blood efficiently back toward the heart. That's when swelling in the legs becomes more frequent. That's when varicose veins begin to appear. That's when you start to feel heaviness after standing too long. Blackberries offer a natural response to that problem. The anthocyanins in their skin have been shown to improve capillary integrity and reduce venous pressure, helping blood return upward through the legs with greater ease. But they don't stop there. Blackberries also contain vitamin K, manganese, and high levels of soluble fiber, which collectively support overall circulatory function. They reduce arterial stiffness. They encourage better blood clot control. And they stabilize the inner lining of blood vessels, a layer so thin, yet so vital. In a controlled study published in Free Radical Biology and Medicine in 2013, researchers found that blackberry extract significantly reduced oxidative stress and improved endothelial-dependent vasodilation in older animals with compromised vascular function. While more human data is emerging, the foundational science is already strong. There's also evidence that blackberries improve nitric oxide bioavailability, meaning the body can more effectively widen blood vessels when needed, especially under physical or emotional stress. That flexibility keeps blood pressure stable and prevents sudden spikes that damage fragile arteries. And perhaps one of the most overlooked benefits is their role in preventing platelet aggregation. Blackberries appear to reduce the tendency of platelets to clump together, a key trigger in blood clot formation, especially in narrowed vessels. For people in their 60s and 70s, where circulation is often compromised by age, diet, or medication side effects, these effects are not minor. They are foundational. So how do you bring them into your routine? The easiest way is to use frozen blackberries. They're widely available, affordable, and nutritionally comparable to fresh. Blend them into a smoothie with spinach and flaxseed. Stir them into warm oatmeal. Or simply defrost a handful and enjoy them plain in the afternoon. Their deep, rich flavor pairs beautifully with warming spices like cinnamon or ginger, which carry their own vascular benefits. It's not about creating the perfect recipe. It's about allowing this fruit to show up consistently in your week. Because blackberries may be quiet, but they're persistent. And when it comes to vascular repair, persistence is exactly what your body needs. You've made it to the end. That already says something powerful about you. It means you care about your health. It means you haven't given up. And neither have your arteries. Because the truth is, they're still listening. They're still capable of healing, softening, opening. You just need to give them the right signals. So here's what you can do starting today. Tomorrow morning, add a handful of fresh or frozen strawberries to your breakfast. On the next day, stir blueberries into your yogurt or oatmeal. Later in the week, enjoy a bowl of raspberries as a light afternoon snack. And when you crave something rich and bold, reach for blackberries. No stress. No perfection. Just one kind of berry at a time, 3 to 4 days a week. If you're buying frozen, choose unsweetened. If you're buying fresh, look for deep color and firm skin. And if you're tight on time, just rinse and eat them straight from the bowl. These small choices may not feel like much at first, but inside your blood vessels, they speak volumes. They lower the pressure. They restore the rhythm. They give your heart and brain the flow they depend on. It's never too late to make space for healing. And it's never too late to believe that something as simple as a berry can change the way your body feels. Thank you for staying with me until the very end. If this video has helped you in any way, please give it a like, share it with someone you care about, and subscribe for more gentle, science-backed guidance. And if you have a story or experience to share, leave a comment below, not just for me, but for others who may need your encouragement right now. Until next time, I'm Dr. James Porter, and your health is still worth fighting for.